When we were last together, Sheri, in January, you and I briefed the public on our report. The federal government's Healthy People effort sets national goals and objectives for health promotion and disease prevention every 10 years and informs the public health planning and measurement at the state and local level. Leading health indicators are a subset of those goals and objectives and are intended to convey high priority issues. Our committee at the National Academies was asked by the federal government to make recommendations for leading health indicators, and we recommended 34 of them that gave priority to measures of well-being, health-related quality of life, as well as, importantly, equity. Now, just a few months after that briefing, the nation faces a really new and sudden and severe threat to health in the form of COVID-19. So we're now grappling with that and how to address the immediate threat of the epidemic and anticipating the longer-term impacts.
Communities that are bearing the brunt of COVID-19 are also communities where large numbers of essential workers live, work, play, and raise their children. And that, I think, hopefully opens up an opportunity to think differently about how we invest in communities and people.
So that's, in a sense, a commentary on the fact that some workers are working at home and some workers are still out in the front line taking risks. And is there a social stratification that then plays out in terms of different groups within the population, racial and ethnic groups as well?
Right, and so I think our report called into attention the importance of income and poverty and employment. And we know that poverty and unemployment is more prevalent in communities of color and Native nations. And that's related to long-standing historical policy and practice. And so there is this differential in terms of who's able to work from home and reduce their risk to exposure and who is still out providing the necessary services that we need as a society to function. So that to me then makes me think more about what are the ways that our policies are assuring that we all have the essential workforce that we need. So evidence-based policies like living wage laws and paid sick leave that have really gotten more attention because of the COVID-19 pandemic.
Seems to me, Sheri, that you're saying that many of these factors pre-existed COVID-19. And that, to put in my words, this COVID-19 looks like a severe stress test on many of these factors. So as you think back on our report that we issued just in January, just before this broke, do you think there's any real difference that's revealed by this? Is it just a matter of degree in terms of the underlying factors and issues? Would you be thinking differently because of COVID-19 with respect to what's happened in terms of our recommendations?
Well, I think our recommendations, many of them are really important right now. So we looked at things like adverse childhood experiences. And what we're seeing already in some of the early data is that there are more severe cases of child abuse emerging because children and families are more isolated, because parents, many are experiencing tremendous stress through economic pressures and other types of pressures. And so making sure that we are measuring adverse childhood experiences and tracking it as these shocks and tragedies to the larger system. We also offered two measures of racial residential segregation. And I think that relates specifically to your comments about how this pandemic is having disproportionate burden, because residential segregation cuts people off from the necessary resources for health and well-being.
right. So the other thing I'm aware of, Sheri, is that you're a former state health officer, and I'm a physician and former chief health officer of the healthcare delivery system. And some of the early reports I've seen see that there are tremendous dislocations in terms of people getting routine care and preventive care, particularly children being getting immunizations and so forth. And I'm wondering about first, the impacts on health as that rolls forward, and then secondly, the disproportionate impact on disadvantaged populations. What are your thoughts there?
Right. So it's a magnifier effect, right? If you already had reduced access to health care because you didn't have health insurance, or you were undocumented, or you lived in a rural area where there's less access, then that's being magnified now in the COVID-19 pandemic. And so we know that also residential segregation is associated with fewer healthcare facilities in both urban and rural areas. And we know there's quite a bit of information about racial bias in healthcare delivery. So we can, I think, expect that these things are going to be magnified or multiplied as we go through this pandemic.
So we're also seeing, massive unemployment, sudden unemployment, and loss of private insurance by some, and long food lines in terms of food pantries and so forth, as well as issues with respect to housing and living arrangements.
Right. So we know that this close quarters puts you at greater risk for COVID-19. And so people that were already living in conditions that were overcrowded, or who were housing insecure, who were paying, for example, more than 50% of their income for rent, that the loss of income puts everyone at, or puts those folks especially at greater risk.
Those are sort of short-term impacts, and then it seems like there may be longer-term impacts as well in terms of the economic dislocation and so forth. And I'm just struck by how certain segments of our society are incorporating behaviors that help people protect themselves from infection. So will health literacy and the distribution of literacy among the population advantage or disadvantage some groups more than others?
I think so. And I think it's also a systems question, right? So how are we thinking about tailoring messages to different communities so that those messages are accessible and understandable, and most importantly, actionable? So using trusted spokespersons and messengers, using mediums that are likely to reach the people that we're trying to reach, whether it's people who speak another language other than English, or people with lower reading levels where we need to use more pictures and graphics, or whether it's really the people who we pick to be the spokesperson so that they represent trusted leaders in communities. So, and that the message is crafted in a way that people can connect to. Early on, we have to be thinking about messaging in a way that's going to reach everyone. I've been really pleased to see the sign language interpretation of a lot of the press conferences. And I think that was a lesson that many states and local governments learned in Katrina, that we were missing a lot of people.
Yeah. There's also been a fair amount of controversy or commentary on the degree of preparation that the country had for this very sudden health emergency in terms of things like testing, the availability of supplies, and so forth.
Now is when we see why it's so important to have a strong governmental public health system. We also included the heat vulnerability index. Summer months come forward and we don't, again, compound people's risk of falling ill or dying of COVID-19.
Right. You had some of our big urban centers so densely packed. They carry risks just because they're communication hubs, as well as travel hubs, as well as as densely populated. And I think the point you're raising here, the heat stress on top of that this summer, could be a very significant issue.
I think that is a really critical message to the public, that these leading health indicators interact with each other, multiply each other, compound each other in ways that the report wasn't able to directly speak to. But, you know, this layering effect of residential segregation, cutting people off from resources, unemployment, compounding the risk for adverse childhood experiences, that these are complex, interrelated problems.
So this has been great conversation, Sheri. I really appreciate the opportunity to visit with you around these important issues. So thank you so much for talking to me about this, and I hope you stay safe as well.
Thank you. I agree, George. I hope that we all learn some lessons and make collective decisions to really protect the health and well-being of everyone.